A tooth that's beyond repair is typically determined by a referring provider or if the patient's requesting our opinion. Basically, if there's not enough natural tooth structure available to make a predictable restoration with fillings, crowns, that sort of thing, where a patient's going to have a long-lasting, successful result from that. Some of the things we can help preventing extraction of teeth would be early diagnosis of dental problems, decay, things that may have been missed in previous checkups, or if a patient has not been seen in a long time, we're sometimes the first line of defense. Patients have been afraid of it going to the dentist or haven't been anywhere in a long time. Identifying those problems early is key in order to avoid unnecessary loss of teeth and further issues. I think offices sometimes resort to extracting teeth because it's either the patient doesn't think they maybe can afford alternatives, or their parents and grandparents all had dentures at young ages, things like that. They just don't have the background to know what their options are for possibly saving teeth when indicated. If you have any dental concerns with multiple failing teeth, even a single tooth issue, please come into Creos for a free consultation so we can help you get your smile back.